Everyone, welcome to the front row. Today we're going to talk about hand pain, specifically thumb pain. Okay, it's a real common complaint, especially as we start to get a little bit more mature. Okay, so the joint we're specifically talking about where it's common to get arthritic changes is at the base of this thumb. Okay, right where the thumb meets a little bone here called the trapezium. Okay, and this is where, because that thumb gets so much opposition over the years, we started to get arthritic changes, and then it starts to hurt. Okay, and then what happens is simple things like opening up a jar all of a sudden become real painful because we're generating a force through there, and that gives us a lot of pain through there, right? So we know there's probably some arthritic changes here. I'm over that 40 age, so I'm starting to get some changes as well too. I get sore hands at the end of the day. So what do we do about it? Okay, so in addition to the pain from an arthritic joint, we could also have little trigger points in the muscle. This is a lacrosse ball. You can use a handball. You can use a small super ball if you want to. I got big hands, so it depends upon what you want to do with it, okay? But the idea is that you want to explore the hand to see, is there any tender points in those muscles? And if so, part of that pain you feel, especially when you generate force, is from a trigger point and not just the arthritic joint, okay? So what does it look like? I'm going to show it to you. So let's pretend my left hand, which is actually not a pretend because I do have left hand thumb pain, okay? So I do this all the time. Okay, so I'm gonna pop back here behind the door, okay? Now, the idea is you're just gonna find a wall, okay? I've got this here so you can see what I'm doing. My right hand is just gonna cradle my left hand, okay? And the idea is that I'm gonna use a little bit of body weight here, okay, to explore that whole area, okay? Now, anything that I find is tender, I'm going to come back and I'm going to work that there for about a 30-second count. Okay, now the amount of pain I should have should be about a 5/10, kind of a good pain, just enough to make your eyes squint, okay, but it shouldn't be real painful, but no more than about 30 seconds on each sore site, okay? And you might have maybe 2 or 3. You can come all the way kind of into the length of the thumb as well too, okay? The idea is that you want to try to compare the painful hand to the non-painful hand, okay? So it's not uncommon to have tenderness in the thumb, even on the side that does not hurt, okay? But more than likely, if you have pain a little bit more on the affected side, then some of the discomfort that you feel is from the trigger point of the muscle and not just the arthritic joint, which means you can do something about it. We can't do a whole lot about the arthritic changes in the joint. You can get surgery, you can get cortisone shots, but you know, I'm all about seeing what we can do with the least amount of intervention, okay? So you find it, you work it, explore the whole area first, 30 seconds at the most per tender spot, okay? So you might only spend about 2 minutes on your thumb and then be done, okay? Because you can't overdo it, but then you can repeat that 2, 3, 4 times in a day, okay? Might take a couple weeks. But as the tenderness starts to come down, you should notice a corresponding increase in strength, okay? And then all of a sudden, simple things like opening up a can of, that's Leah's, it's really, really hard. Okay, opening up a jar of, what is this, blue cheese dressing should get a whole lot easier to do, okay? So give it a try, see how you do. Simple exercise for thumb pain, okay? Good luck.